Amit sir for the kind introduction, and I'd like to thank Sonu sir and Partha sir for having me here. So today I've been asked to talk on cracking the brown and black cataracts. I don't have a formal presentation, but just a couple of videos which I'll keep under 4 minutes. So I'll start off with the case directly. So this is a grade 4 to 5 nucleus. And this was a patient who was also wanting a toric multifocal lens. So you can see the toric markings in place. Trypan blue is something definitely which we use in these cases, as you don't necessarily have a good red glow. And using a good viscoelastic is always helpful. With regards to the capsular exercise, I like to make it slightly larger than what I would in my traditional cases, because it helps in, even if you're not able to chop it wonderfully and if you have to extract larger pieces, but at the same time, not too large that you don't have an overlap over the lens. Doing a gentle but multi-quadrant hydro is extremely important, as any aggressive movement of this nucleus can cause zonular dialysis in these cases. I do a central trench. Now, the length of the trench is not necessarily very important. It's the depth which is more important. But a central debulking always helps, as it provides more space. And it also helps you to occlude deeper so that your first chop can go right up to the crater itself. Now, this chop in these hard cataracts, because you don't want too much lateral extension, may not go right or across to the entire extent to the other end. So rotate the nucleus by 180 degrees and then go on to chop at a deeper level till the central spine is broken down. Again, you can do the same things, occlude, and again, keep chopping. As you can see, I keep going deeper and deeper till it is chopped right up to the center. Traditionally, what is being referred to as a multi-level chopping. You start a little more superficial, but keep going deeper till you're right up to the base. I'll talk a little bit more about the emulsification in my second video, which I'll be showing. But suffice to say, it is important that you have chopped it down into multiple pieces before you go ahead with the emulsification process itself. Subsequently, there is usually very little cortex left in these cases. I go ahead with the IOL implantation here. Like I mentioned earlier, having a large capsular excess is helpful, but again, it should not be too large, especially when you're doing these toric or multifocal lenses, as you need a uniform overlap, as you can see in this case. And subsequently, once the lens is placed, it's important that you do a complete viscoelastic removal from behind the lens. And before I remove the irrigation cannula, I position the lens, hydrate the opposite ports so that there is no sudden shallowing of the chamber. Hydrate both ports so that the lens is perfectly in position. Moving on to this next decidedly darker and blacker nucleus. The pupil is also slightly smaller in this case. I do a gentle multi-quadrant hydro, just summarizing the points which I mentioned in the earlier case, and ensure that I have a good rotation. Now here, as you can see here, I'm making a really deep central crater so that I can embed as deep as possible so that I can crack the spine of this hard nucleus. Now, as you can see, I go ahead with a horizontal chop, and as I do it, it's only the half nucleus right up to the center which is cracked. I rotate it by another 180 degrees, go ahead, and then complete the chop right up to the center. Now, even when you lose a hold, it's important that you let go ahead and grasp it again, and then continue your chopping. You will not be able to chop right up to the very depth, probably in your primary chop in these hard cataracts. So it's important that you keep separating, going deeper at a multi-level and ensuring that the last bit of fibers are also separated. It's important that you have a complete separation before you start emulsifying the pieces, because any premature emulsification or any premature attempt to remove the piece into the anterior chamber can cause excess stress on the zonules. And it's important when you start removing the first piece that you ensure that your capsular excess margin, you have a look at it and ensure it's not tilting in one direction, because any excess maneuvers during your chopping procedures can cause a little bit of zonular dialysis, and you have to be exceedingly careful that it does not extend during the residual part of your phacoemulsification. Towards the last pieces, one important thing to keep in mind is that the phacoemulsification needle can actually bore through the density of the nucleus, and you have to make sure that your nuclear piece is not above the tip of your phaco needle. You have to ensure your phaco needle is always above the nuclear piece, and there is a sufficient nuclear piece below your phaco needle so that the phaco needle is not directly exposed to the posterior capsule. These are just some of the simple tips that I follow for dealing with these dense nuclear cataracts. I hope you all found it useful.